Ladies and gentlemen, dear colleagues, first of all, let me thank you, Carmen Carvalho, for her so kind invitation to speak about this challenging, very challenging subject. I think we should produce many more efforts towards this important subject for the future of the planet, of course. And I hope you will be very kind and forgive me for my effort that I'm going to produce. So first of all, I'd like to thank Gaia Cipresso, who is very talented consultant neonatologist in this area. She has done a lot of formation for us because I think it's an important subject. When we speak about sustainability challenge, we should talk about what should comprehensively go in environmental, economic, and social sustainability, and automatically try to do that kind of things. Of course, this is a project for the future, but we can definitely observe that we probably have done something already, or we're trying to do something already without thinking to the green sustainability automatically achieved without thinking about that. But if we think again on this triple kind of aim, I'd like your attention on a subject, the painful heel pricks. Of course, the painful heel pricks are using disposable things to perform the heel pricks, and after we destroy it, we put in the bin. But we produce a lot of pain, discomfort for neonates. We know that since a while. I'd like to show you our experience in showing how important are repetitive skin breaks, heel pricks in these babies. We divided this population in 3 categories, try to show, and I think we succeeded, that those exposed to more heel pricks were having a weaker functional connectivity in the brain, the thalamocortical pathways, and between right insular and limbic system. So it's bad for babies, it's bad for the environment to use many heel pricks, disposable stuff. And can we do something about that? Can we reduce heel pricks? Of course, it's not an easy subject, but again, if we focus, for instance, on the risk of hypoglycemia, and we plenty of categories more vulnerable on developing hypoglycemia from premature birth and go on, we should really think about that we have now something that can reduce the heel pricks. This is a very nice, extremely recent paper from the Padova group in Italy. At first, they focused on the importance of glucose continuous monitoring compared to the point-of-care blood glucose. And of course, they showed us that the data are consistent. And they were the first one, 2017, as you can see here, showing that the continuous glucose monitoring guided glucose titration increased the time spent in new glycemia and also reduced hypoglycemia, minimized glycemic variability, another important subject in the first week of life, but they didn't highlight how it can reduce the number of heel pricks. And we're concentrating on this also subject. And couple of years ago, we showed also some interesting aspect in which if you give boluses euglycemia, normal values of glycemia are more protected. So why we should concentrate on that? Well, it matters for sure. Patient outcomes, as we observed, cost effectiveness, long-term benefits for the environment, something that is easy to understand. And also the cycle inside the NICU. We have this very nice picture showing that they start moving from the environmental pollution. We will have more NICU admission. We will have, for sure, for instance, this is pretty evident that the rise in the temperature may trigger as well the increase in preterm birth and stillbirth as well. So if we speak about neonates, we can't forget, sorry, the prenatal life, the fetal life, and of course the obstetric care. And so we know also that pollution in pregnant women may increase the risk of cerebral palsy, and there are a number of new data and studies showing any kind of pollution like those satellite derived. Extremely important is focusing on prematurity, and there are a lot of data showing that pollution increase prematurity as well. And this is, I think, something important because there is the evidence and the clinical implication more than doubled, more often confirmed, corroborated by many studies like this is important study on global reports of American Journal of Obstetrics and Gynecology. And I would like also to have your time considering how important is maternal health in that. Because maternal health, apart from pollution and from some kind of habits, for instance, there is a growing problem. People are eating too much, consuming a lot of foods, and blah, blah, blah. But again, obesity, and we know this logo, this acronym, OWO, overweight, obesity, how many complications, again, focusing on prematurity, focusing on the complication of prematurity, having small gestational age for babies, higher risk of hypoglycemia, we discussed this as well, and macrosomia and many others. This is not the point. And this is a sort of vicious circle again, because more obese people produce more obese and more obese in addition. And this is something about education we should consider, and everything is linked. So the impact inside the NICU is important as well, and the NICU patient as well. And I love this new way of considering the carbon footprint in the NICU, no? So we can speak about primarily the transportation, so moving every day to the hospital, moving disposal for the use in the hospital. And this is also the doctors, how many doctors, and this is going to really give our attention on this area we normally don't. As I told you before, everything speaking about neonates has to start from the prenatal life, and we concentrate on plastics and CO2 and CO2 production. This is the way of considering how it can be produce CO2 and how bad it is for the planet. And the quality of air inside the neonatal intensive care unit is becoming a hot topic even in our country, because we think about air filtration and exposure reduction strategies. So this is something that is going to improve for sure, and we hope it will give us many results in a short while. Speaking about plastics, we can't forget that we know since a while the negative role of phthalates that are seen everywhere and what they're causing. And this is my pleasure to remember an Italian researcher that now is 84, He retired a few years ago, and he was the first one, at least in our country, to highlight the importance. He produced something about 30 papers on the subject about the phthalates. Also, in my opinion, very important. The first one to say that was disrupting endocrine function, like for thyroids as well. So I think this is now current knowledge, but it was not few years ago. There are specific recent data on scientific reports, and so we have to be optimistic because we know something like that. But we also think about that sometimes we are not fixed to the use of the parenteral nutrition in the same way. So I'm one of those open to think about that we may improve and tailor the use of parenteral nutrition because for sure now we try to, how to say, to fill the gap in between the time of fetal nutrition and nutrition of the baby by maternal milk, for instance, and that's for sure reducing the potential of extrauterine growth retardation. So I'm showing this baby that is in our unit in these days. Very simple case in which we managed to have the birth weight babies in a sort of good time, but you see the triumph of plastic in our units, and thinking about phthalates and things like that is not an easy job. The baby still got TPN. I told you we may discuss how long we should go with TPN, and this is the maternal milk with the purple line, as you know, that we try to differentiate to avoid errors. And this is just the common time after 2 weeks, in which there is still a balance in between TPN and enteral feed. And what I'd like to tell you is that I don't know, but I think there is still room to think about to optimized parenteral nutrition. If we concentrate, just to give you my research area idea, that between 30 and 40 weeks is the most important time to produce myelin in the brain, that is so important for brain functions. You see, in between 30 weeks and 40 weeks, this is the periventricular area of the brain, the white matter. At 30 weeks, very few white matter. At 24, no white matter at all. At 40 weeks, is pretty organized. And so the lipids, the quality of lipids, how long we should go on good lipids, and we still do not know which are the best. I think is something that we may improve in the future, focusing on the best time to give nutrients to these babies. But going back to some more common sense approach to sustainability, the costs are for sure so important as well. So the very low birth weight babies, the preterm, those having perinatal condition like in small gestational age babies, birth asphyxia, of course, and all the respiratory problems needing surfactant are those accompanying extremely high cost of living. So what else? What we should also think about is that becoming a parent, in a way, increase the amount of things to do. And so we probably need to educate parents to trying to avoid these vicious circles links in between people. And this is what probably we can do, sustainable practice in NICU. So I think this is a very important. Education is hugely important, and we do very little education for doctors, for other people involved in healthcare, for parents too. And this is, I think, is one of the best paper I could read and you can see how we can improve sustainability. And also how to share results. This is an important point. So having links, having networks in order to highlight the most important things that we can do. Uh, Also the life cycle analysis, LCA, and this is very important, transportation, distribution, how to reduce that kind of burden. And this is how to say, an ironical approach, in my opinion, that is pretty useful to know and to read the 10 R words that can have the highest impact on carbon emission reduction. So refusing or reducing using materials. So this is important as well. It's not an easy. The hospital are obviously always worried about costs more than this aspect because they have the problem of the budget. So cost is primarily, but we should try to educate them as well in this area. And again, the single-use items. So this is a crucial point, and I think this is a very important and laudable initiative in Hunter, New England, where they try to, you see, recycling a baby bottle. And so this is an important educative point and a really substantial point. The nappies, eco-friendly. I still remember names of the cotton nappies that we use at the beginning when I was doing my job, and also redistribute and repurpose the equipment. So this is the most difficult subject. Telemedicine, of course, is giving some help in this area. Telemedicine is an important area. Of course, we will have limitation to use telemedicine, but I think we will not able to avoid telemedicine on a daily practice. In the neonatal intensive care medicine, you can reduce, for instance, visiting parents because they can connect from home to see their baby. We can avoid to keep them coming to the hospital to speak about health status of their babies. Of course, they should feel freely to come whenever they like. And that was the point I was highlighting just now because of visiting. So hub hospitals versus spoke hospitals, giving back babies as soon as possible to spoke hospitals in order to reduce carbon emission. This is what we're doing in our county, Liguria, where Genoa is based, and we have the responsibility of the neonatal transport system, and we do telemedicine even with our doctors in order to reduce inappropriate transportation of neonates to spokes, to spoke delivery points. As you can see in our county, in Italy, the health service is county based. So there are also more organized programs, such as this one, called STEM, that is this tele-evaluation and measurement. This is, I think, is an important point we should not only highlight, but try to improve everywhere, because it's a methodological issue helping practice in the NICU. I think it's an important point as well. And let me conclude with some ironical approach. We still consume much less compared to computer, our brains. And probably the best part of thinking about to reduce wastes and things like that is the most simple ones. So if we concentrate on something that is really giving us the physiology of a newborn baby, like the sucking activity, well, we know that at 35 weeks, we will achieve a proper sucking activity compared to a normal full-term newborn baby. But often this is delayed in premature babies. Often we just not do a lot of things to accelerate this timing and this efficiency that is able to avoid tubes and bottles. And if we concentrate on the good things that we can do, we can for sure use a sort of training for delivered by nurses, by doctors, also to the parents, like a motor intervention and practically speaking, a massage in the area of the mouth and the lips, so highly distributed in the motor cortex. So it's like producing a massage in the all the body that we know is so useful to relax babies for good feelings of the babies. I'm not speaking about kangaroo, of course, but we are in that kind of area, and we showed that we can educate parents for to achieve earlier this effective sucking activity that Mother Nature is suggesting is around 35 weeks. But I can tell you, we can really have sometimes premature babies that at 34 week of corrected age are able to suck the entire amount of milk that we are giving to them. And so we may concentrate of early discharge from the NICU, less number of gastric gas or gastric tube, and etc. in this field. So thinking the simplest things to do in this new wave of respecting our life, our planet, and absolutely our daily work inside the neonatal intensive care unit. So I think at present time, networking, I think this initiative, I thanks again Carmen for this laudable initiative. And in my opinion, everything has to start from educating people. And so we have this, I think it's a right and more than a duty to educate and to be educated on these subjects. And I thank you so much for your attention. Thank you so much.